So we're gonna talk about respirations.
What do you learn?
All right. So our objectives are to define respiration rate, identify normal respiration rate for various age groups, describe respiration rate, character and rhythm, identify abnormal respirations, and take and record respirations.
Respiration.
All right, so respiration is one of the four vital signs, and it describes the process of taking in oxygen and expelling carbon dioxide. So a respiration is counted as one inspiration or inhalation and one expiration or exhalation. So when you breathe in and breathe out, that's one. Breathe in, breathe out again, that's two. Inhalation is to breathe in, exhalation is to breathe out. I think y'all know that. Respiration is assessed by rate, character, and rhythm. How is one respiration counted?
One inhalation, one exhalation. Oh, all the above.
Right. So it's one inhalation, one exhalation, one inspiration, and expiration. Respiration is assessed by rate, character, and rhythm. Somebody said false? Did somebody say false? Mm-hmm.
Respiration rate.
All right, so respiration rate is a number of breaths per minute. So how we had pulse is BPM, respiratory rate is also BPM, but it's breaths per minute instead of beats per minute. So recall that one respiration includes one inhalation and one exhalation. So normal ranges for respiration rate vary depending on the age, just like how pulse or heart rate was determined, what it was, like have a range for each age. So is respiration. So adults normal range is 14 to 18. However, a range of 12 to 20 is also considered normal. 12 to 20 is like the standard. That's what we go by, 12 to 20. For children, normal range is 16 to 24, and then infants, normal range is 30 to 50 breaths per minute. And infants, like they breathe off funny, especially in the beginning because they're not, they gotta adjust to being outside the womb, and they don't have to do all those things inside the womb. So trying to get air, and it's kind of like they're trying to figure it out. So they might breathe like um, you know mouth, breathe nose, or whatever. So it's a little bit different with the babies. Normal respiration rate is different for various age groups.
True.
Right.
Respiration character.
All right. So character or quality can be described as normal, shallow, deep, or labored. So if you're sitting there, somebody's taking your respiratory rate, you got a normal rate. That means you're not labored. That means you're not working hard to breathe. You're not shallow. Shallow means taking like you're not breathing deeply, which is what you're supposed to do. Not like like that, but just normal kind of taking deep breaths. Deep breaths is good because it helps to make sure you're using all areas of your lungs. If you don't do that, that's when pneumonia can set up and other problems can happen. Normal respiration should be effortless, quiet, and regular because it's like a part of the autonomic nervous system. We don't think about breathing. It's just something that does. Your brain and your lungs and everything work together. Respiration might also be characterized as difficult, moist, and stertorous. Stertorous is an abnormal respiration that sounds like snoring. So if somebody is sitting there and they're wide awake and they're snoring, that's not normal. They're breathing and snoring. Obese people sometimes will do stuff like that. But they got a lot of stuff. They got, all that fat is pressing down on their internal organs. So that could be the cause of that.
Respiration rhythm.
All right, so respiration rhythm is described as regular or irregular. Regular respiration rhythm has an equal spacing of breaths. Irregular has an unequal spacing of breath. So we say 12 to 20, nice and easy, just breathing normally. If you're like breathing fast, breathing slow, like it's not a regular rhythm, then that's gonna be irregular. Which respiration assessment is typically described as normal, shallow, deep, or labored?
Yeah.
Right. Which assessment is typically described as regular or irregular? Right. Rhythm.
Abnormal respiration.
All right. So as with all vital signs, abnormalities in respiration usually signal a health issue or disease. There are various types of abnormal respiration. You have dyspnea, that means it's difficult or labored. So that means you're having like a hard time breathing, you can't catch your breath. You might be, we also call dyspnea shortness of breath. So like if you're running, doing any kind of exercise, can't catch your breath, then you're what's called you have dyspnea. Apnea is a temporary absence of respiration. So people that have sleep apnea, that stop breathing, if you stop breathing for 20 seconds or more, that's considered apnea. And people really like stop. They like. Do y'all know anybody with sleep apnea?
Mm-hmm.
No. Yes. Have y'all ever watched them like stop?
Yeah. And
You
they shouldn't have put them
really?
in here. Mm-hmm.
Do they wear a machine at night?
No, that like when it do happen, like when they have to go to Birmingham and they stay at Birmingham all night and they do treatments and stuff on them, like procedures.
Is it an adult?
My brother.
Both of them?
Mm-hmm.
How many? You got?
They 10.
Oh, how old are they?
Well,
Like it's crazy to see. Uh, of course, I'm a respiratory therapist, so I've seen people that have apnea. It was this young guy one time. He would like just stop. Like, I was walking in his room and I was just standing there watching the monitor. Like, he just like stopped, nothing. So then his heart rate started going down. Of course, his respiratory rate is at 0. His oxygen level starts going down. So, and then it's like he'll take a breath. So, but he has to wear. They have those CPAP machines. That's what that's for, to try to kick them in to take a breath. So that's why you hear people, people that's been married years, or have somebody that they sleep with every night and they'll hit them. That's for them to take a breath because they've stopped breathing. So tachypnea is respiration above 20 breaths per minute, and then bradypnea is below 10 breaths per minute. So we know normal is 12 to 20. So we'll take about 22, 24, but once you get above 25, we'll say that you're breathing too fast. That's tachypnea. And then 12 is normal for normal, and so 10 would be slow respiration. So that's bradypnea. So orthopnea is when you have to um like you can't lay down. Like people that can't lay down, if you know anybody that sits up in a chair to sleep, it's because when they lay flat they can't breathe. So that's what orthopnea is. And then chain Stokes is a breathing pattern that consists of short, shallow breaths followed by deeper, more frequent breaths, followed by apnea for 10 to 20 seconds. Now try to find a example of chain Stokes. It's just their breathing is like really irregular. So this breathing pattern often signals that a patient is near death. Rales is respiration that is noisy. Rales can occur in patients who have. Teachers and students, please excuse this interruption. With Tradarius Parham, please report to the main office. Tradarius Parham, please report to the main office. Thank you. So people that have pneumonia or bronchitis, they might have breath sounds that sound like rails. Wheezing is respiration with a high pitched whistle or sigh during exhalation, and difficulty breathing as heard in asthma patients. And then cyanosis is when skin, nail beds, or lips turn bluish in color as a result of a shortage of oxygen in the blood. So sometimes when people start having like these breathing issues, they stop breathing, like apnea or whatever. Like you can see like their like around their mouth might be blue, like lips and stuff might be blue looking. Their nail beds. So that's cyanosis. So cyan, this prefix or whatever root word, cyan means blue. So that's what it is. Let me see if I can find a change Stokes real quick.
Good morning, everyone, and welcome back. Today we'll be talking about Shane Stark's breathing pattern. It can be caused by anything that causes cardiac damage, mainly endocarditis and rheumatic fever. When there is cardiac damage, the blood flow is disturbed. This causes irregularities in the carbon dioxide. Shane Stark's breathing pattern is described as a period of apnea followed by gradual increase and decrease, and another episode of apnea. And here's how it sounds like. In most cases, treating the cardiac cause resolves the pathology.
In this video, we'll discuss Shane stroke breathing, a breathing pattern.
Watch his stomach. This is not normal. Well, he's apneic. Stop breathing. This is his heart rate was 46. His oxygen level was going down because he stopped breathing. That's what that is up to. See his oxygen level going down because he stopped breathing. Now he's gonna start back up again. That's heart rate. Heart rate is just 60. And then this is his oxygen level. So it's going back up now because he started to breathe. But once you stop, everything stops. It starts going down.
What's your oxygen level?
Anything above, well, it kind of depends on the patient. 92 and above is good.
People with ADHD save 10 hours.
If they have like breathing issues or something like that, we'll take something a little bit lower. But it kind of depends on. But like us, we should all have like 98, 99, 97, something like that. But like people that smoke and got issues, they might be running a little bit lower. So that's what that like people that get COVID or whatever, they want you to watch their oxygenation. Because I know my husband, when he had COVID, he said they asked that he have a pulse oximeter at home, which he does because I'm a respiratory therapist, so I got my own. But because you can tell, it's somewhere you can tell if it was the Delta variant as opposed to like the first strand of COVID. So your patient's lips have a bluish tint and is breathing is labored. What should you immediately tell the physician? Patient has dyspnea and is showing signs of cyanosis. All right, so what is difficult or labored breathing called? Dyspnea. Okay, temporary absence of respiration. Apnea. Respiration above 25 breaths per minute. Tachypnea. Respiration below 10 breaths per minute. Bradypnea. Respiration is easily possible only when sitting or standing. Orthopnea. Breathing pattern that often signals that a patient is near death. Cheyne-Stokes, right? Respiration that is noisy. Which one?
I'm not saying nothing. Oh, it's real.
Respiration with a high pitched whistle. And then we got cyanosis. All right.
Assessing respiration.
All right, so when you assess somebody's respiration, unlike other vital signs, respiration can be partially controlled by the patient. If a patient is aware that respiration is being assessed, the patient may alter their breathing pattern, which could lead to an inaccurate assessment of this vital sign. So if I'm taking your respirations and you know that I'm taking your respirations, you can change, your breathing pattern. I mean, especially if you think about it, you can change it. So what is done is once you take a pulse, you go right into respiration. You won't tell the patient. You'll just start looking at them, looking at their chest, taking their respiration, because you don't want them to alter what they got going on. So, like it says, respiration is typically assessed right after pulse is taken. In fact, the healthcare worker should allow the patient to believe that the pulse is still being taken when in actuality the patient's respiration is being observed. So you'll sit there, do their pulse for a minute, they're looking off, they don't, not paying you any attention. So once you get, in your head, whatever their pulse is, then you'll just go right into just watching their chest go up and down, counting their respirations. So they won't ever know that you're actually assessing them. Which of the following is considered an abnormal respiration? All of them. So you got dyspnea, apnea, and Cheyne-Stokes are all abnormal. Patients should be told when their respirations are being assessed. False. You don't want to tell them. Cause it gets kind of weird if somebody's just sitting there standing, standing at your chest. So it can get a little weird.
Procedure for respiration.
All right, so basically that's what that checkoff sheet I gave you. So it's important to learn the correct procedure for taking and recording respiration. Respiration should be taken immediately after taking a patient's pulse. You should leave your hand in the same position used for taking the pulse. Allow the patient to think that you're still counting pulse. You should not inform the patient that you're monitoring respiration because patients can alter their rate of breathing. Individual agencies, they have their own thing. So you'll wash your hands, introduce yourself to the patient. With your fingers still in position used to take the patient's pulse, you're going to count the number of times the patient inhales.
Cleanse your hands and introduce yourself to the patient.
So remember, when they inhale and exhale, that's one. Inhale, exhale, two. Inhale, exhale, three. So you'll count that for 1 full minute, how many times they inhale and exhale. So you'll use second hand watch or clock and count respiration for 1 full minute. So while you're counting their respiration, you're going to pay attention to their character and rhythm of the respiration.
Procedure for respiration. Record the following.
So you'll record following respiration data on note paper, but you got that little sheet, so you record whatever. You're not gonna have room to write all that stuff, so I mean you might can write it like in the long box on the side over there. But I think y'all wrote something. Did I write something in that long box? Did I tell y'all to write something over there already? No, on that sheet, the other sheet that y'all taking the vital signs. What y'all wrote? The name? Oh, okay. It's fine. Just write the what you got. Alright, so you'll check the patient, observe all safety precautions, wash your hands, record following data on the patient's chart, date, time, respiration data. So R18, deep and regular. That's the character and rhythm, your signature. So if you will have any abnormal pulse data or observations, you'll tell your supervisor. Respiration should be counted while your fingers are still in the position used to take the patient's pulse. True. Alright, so what is the correct order of this?
Read the sentence.
Huh?
Pay attention and record the data in. And put record and count. Like the last. I know switch count with that.
Right. So you'll leave the fingers in the position used to take the patient's pulse. You're going to count the number of times the patient inhales and exhales for 1 full minute. You're going to pay attention to the character and rhythm of the respiration, and you're going to put what you get in the patient's chart. So how long should respirations be counted? 1 minute. 1 minute, not 12. 1 minute.
Pulmonary function test.
All right, so you got something called pulmonary function test, or we just say PFTs. They're used to measure breathing and how well a patient's lungs are functioning. The test measures lung volume, capacity, rates of flow, and gas exchange. This info can help a healthcare provider diagnose and decide the treatment of certain lung disorders. Examples are, you got something called spirometry. It can be used to measure airflow, specifically how much air is inhaled and how quickly it is exhaled. So to take a spirometry test, measurements are taken as the patient sits and breathes into a mouthpiece that is connected to a spirometer. Spirometry can be used to evaluate many lung diseases like asthma, COPD, and other conditions that affect breathing. Then you have plethysmography. It's a lung test performed to measure the compliance of the lung by determining how much air a patient's lungs can hold. For this test, the patient sits in an airtight clear box that looks a lot like a phone booth. The patient will breathe in and out of a special mouthpiece. Changes in pressure within the box can then be used to determine the lung volume. So when people have to get evaluated for any kind of breathing issues the doctor thinks they have, they might send them to do PFTs. So that's what that is. All right. I got 2 videos I put in y'all's folder. One is to count just regular respiratory rate, and then one is to count infants. So we'll look at those 2.
One could say I had some struggles with nursing school.
I struggled throughout nearly all nursing school.
Hey everyone, it's Sarah, registerednursern.com, and in this video, I'm going to demonstrate for you how to count a respiratory rate. This is one of those very important vital sign skills that you have to do as a nurse or a nursing assistant. So in this video, what I'm going to do is I'm going to go over the basics of counting a respiratory rate, and then I'm going to show you how to do it on a real person. So first, let's cover the basics. Whenever you are looking at the respiratory rate on a patient, you're looking for several things. First thing you're going to be looking at is the rhythm. And you're going to look at the breathing effort of the patient. Whenever you're looking at the rhythm, you're looking at to see if it's regular or irregular. And what you're paying attention to is that inspiratory phase and that expiratory phase. The inspiratory phase is whenever they inhale, take a breath in. An expiratory phase is whenever they exhale, take a breath out. And what you're looking at is to make sure that they are equal. because in some patients, for instance, patients with chronic obstructive pulmonary disease, COPD, the expiratory phase will be a little bit longer than the inspiratory phase. So they'll take a breath in, and then they'll breathe out. And it'll be a lot longer. Now, next thing you're going to look for is, how is the patient breathing? Are they having difficulty moving air? Are they having dyspnea where they're going, or is it just effortless for them? They're not really even aware that they're breathing, just like how you're blinking. So you want to pay attention to that. Next, you want to count that breathing rate. You want to make sure that it is within the normal range. For an adult, a normal range is 12 to 20 breaths per minute. So we're making sure that they meet that criteria. So to do this, typically what you do is whenever you go in to do your vital signs, you'll plug in and you'll count a radial pulse by feeling on the radial artery, and you'll count that for 30 seconds if it's regular. And then while you're still holding the radial pulse site, you are going to look at the chest of the patient. And you are looking to see how that chest is rising and falling. And you're counting those rising, the rising and the falling as one breath, because one inspiration and one expiration equals one breath. And you're going to do that for 30 seconds. And after 30 seconds, you'll take that number, multiply it by 2, and that is your respiratory rate. So the reason you want to hold the radial pulse while you're counting the patient's respirations is because if a patient knows that you're counting their respirations, they're going to throw them off. And it's just like blinking. If you tell someone, I'm going to measure how much you blink, the person's going to be aware of how much they're blinking, and they're going to be conscious of it, and it's going to throw what the normal rate would be. So after you get done counting the respirations, let them know that you were counting the respirations. Now let me show you how to count respirations on a person. Hi, my name is Sarah, and I'm going to be your nurse today, and I'm going to take your vital signs. Is that okay with you?
Absolutely.
Okay, so I've performed hand hygiene, and we're going to get his vital signs. So let me see your wrist, and I'm going to feel your pulse. Okay, so your pulse rate was 70 and your respiration rate was 20. So that is how you count a respiratory rate. Now be sure to check out my other videos on how to do other nursing skills, and thank you so much for watching, and please.
Okay, I'm gonna show y'all the infant one, then we'll go to lunch, and after lunch y'all can practice the respiratory rate on whoever y'all.
So I've got my essay
partners
written,
are.
and I've been working on it for about a week. So now I'm going to show you how I use Grammarly to edit. Okay, so here's my...
Hey everyone, it's Sarah, the registered nurse, RN.com, and in this video I'm going to demonstrate how to count the respirations in an infant, and of course perform hand hygiene before beginning. And a normal respiratory rate in an infant is about 30 to 60 breaths per minute. So before we even start counting respirations, we want to look at that infant, and we want to make sure that they're not in any respiratory distress. So one way we can tell is we can look at the nose. Infants love to breathe through their nose. So we're checking their nostrils, and we're looking for nasal flaring. And if you see that, it's not a good sign. Also, you want to look at that chest, and you want to look for anything like chest retractions. And what that looks like, it literally looks like the skin has just been pulled over the ribs, and you can see the ribs very well. And this infant does not have either of those things. In addition, you want to look at the infant's skin color and make sure it's appropriate for their skin tone and that you don't see any signs and symptoms of cyanosis. So to count respirations, what we're going to do is we're going to count for 1 full minute, the rise and the fall of the chest. Now, with an adult, you probably remember that if the rate was regular, we could count for 30 seconds and multiply by 2. Well, this isn't the case with infant. You're going to do it for 1 full minute because infants' breathing pattern is irregular. They have what's called periodic breathing, where they'll breathe and then they'll stop for a second. So we're going to count for 1 full minute, and we're looking at that rise and that fall of the chest. And infants like to breathe abdominally. So if you're having trouble, what you could do is you could lightly place your hand on the chest and feel the rise and the fall. But you want to be careful not to disturb the infant and get them crying. So I'll demonstrate and I'll count with each rise and with each fall just to give you an example. So here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9.
How they breathe all
So you want
crazy
to count that rise and that fall for 1 full minute and then document that number. So his respirations were 38, which again is normal because the normal rate is about 30 to 60 breaths per minute. Okay, so that wraps up this video on how to assess respirations in an infant. And be sure to check out the other videos in this pediatric series.
All right. Oh, hold up for lunch.